The launch of the investment case for mental health in Kenya. The investment case for mental health is a national assessment used to provide evidence-based rationale for investment in mental health. It also details the impact that scaling up investment in prevention and treatment of mental health conditions in Kenya would have in the long run. The investment case can be used to showcase the benefits of scaled-up action to relevant health or non-health decision makers and as an advocacy piece to raise interest and investment in mental health. The burden of mental health conditions placed on the economy can be viewed as an iceberg. The top and visible part representing direct costs, such as how much the government spends on mental health care. In Kenya, the government spends 5.5 billion Kenyan shillings on mental health care per year. The bottom and larger part of the iceberg represents the indirect costs, such as reduced productivity and loss of workforce. These hidden costs are 10 times higher and equate to about 56 billion Kenyan shillings per year. The economic analysis consists of 4 steps: estimating the economic burden of mental health conditions, assessing the health impacts of interventions, costing of these interventions, and analysis of return on investment. The total annual economic burden of mental health conditions to the Kenyan economy is about 62 billion Kenyan shillings. Government healthcare expenditure represents only a fraction of all mental health-related costs. In Kenya, the impacts of investing in 7 intervention packages for mental health were assessed: scaled-up treatment of psychosis, bipolar disorder, depression, anxiety disorders, epilepsy, alcohol use disorders, and population-based prevention interventions. The assessment presents a viable path forward with significant yet realistic scale-up of coverage levels of these interventions between 2021 and 2041. This will have huge impacts in reducing the adverse consequences of mental health conditions through preventive and treatment-based interventions. As treatment rates are scaled up in the population over time, the number of healthy life years gained increases markedly, up to 650,000 healthy years between 2021 and 2041. The greatest impacts were observed for depression, followed by clinical interventions for anxiety and epilepsy. With respect to both increased productivity gains and the social value of health over 20 years, interventions for managing and reducing the number of cases of epilepsy and depression have the highest returns on investment. The report concludes with 5 actionable steps that Kenya can take to strengthen a whole-of-government, whole-of-society approach to reduce the adverse consequences of mental health conditions and increase people's mental health and well-being, their life expectancy, and quality of life. In summary, mental health conditions in Kenya cost almost 62 billion Kenyan shillings every year, with over 90% of this as indirect costs to the economy. By investing in the suggested evidence-based interventions, Kenya could save over 20,000 lives and gain 1.6 million healthy life years for Kenyans over the next 20 years. By acting now, these investments will contribute to the overall development of Kenya with positive ripple effects across society and to accelerating economic growth and social development.